Let's go to visual diagnosis inspection. The topic is tongue body shape. The shape of the tongue includes the tongue size, physical shape, whether there are cracks on the surface, and the length and mobility of the tongue. The tongue's shape will mainly reflect whether there's a deficiency or excess condition. The tongue shape will give an impression of the condition of qi and blood, as well as whether wind and dampness are present. The shape of the tongue will also reflect the severity and duration of the imbalance. For thin tongue, there's blood or yin deficiency, pale or red without coating, respectively. When it is swollen, there's dampness or phlegm. Partially swollen, there's heat. Stiff is interior wind or blood stasis. Flaccid, deficiency of body fluids. When the tongue is long, there's heat. If it's short, there's severe yang or yin deficiency, and it's pale or red without coating, respectively. When it is cracked, heat or yin deficiency. Quivering is spleen qi deficiency. Deviated is interior wind, and tooth marked is spleen qi deficiency. A pale, wet tongue that has risen due to yang deficiency is less serious and indicates a shorter duration than if the tongue is pale and swollen. The swelling of the tongue indicates that the yang is chronically weak and therefore not performing its function of transforming and transporting fluids in the body. Similarly, yin deficiency that manifests with a tongue that is red and without coating is not as serious and chronic as yin deficiency that manifests with a tongue that is red, thin, lacking in coating, and with cracks in the surface of the tongue. The latter shows that the yin deficiency is so deep-rooted and chronic that it is starting to damage the body's tissues. Even though the shape of the tongue is highly significant, it is still the tongue color that is the single most important aspect in tongue diagnosis. Let's look at the observation and significance of the tongue body shape. So a normal tongue is neither swollen nor thin, and the same shape all over, flexible but static, and has no cracks. When the tongue body is thin, the significance is yin deficiency, blood deficiency, or lack of fluids, and there is dryness. When it is pale, large, swollen, and tooth marked, there's qi and yang deficiency or damp phlegm. Normal, colored, and swollen is dampness or phlegm. When it is red and swollen, there's stomach and heart heat and damp heat. Purple swollen could be poisoning. Partly swollen depends on the color and the area. The sides, like the liver and gallbladder, fire if the sides are red, or liver qi stagnation if the sides are normal colored. The middle of the sides or teeth mark spleen qi deficiency. The tip is hard and usually phlegm or heat. The front third, lung, usually phlegm, but can also be qi deficiency. When there are sunken areas, which depends on the areas, if it's in the middle, your stomach and or spleen qi deficiency. If it's in the front, there's lung qi deficiency, and at the rear is kidney jing deficiency. When the tongue is quivering, there's wind or spleen qi deficiency, and when it is stiff, interior wind, and if the tongue is red, this is due to extreme heat. Flaccid and pale tongue is spleen and heart qi and blood deficiency. Flaccid and red is heat. Flaccid, red, and dry is kidney and deficiency. Long is heart fire, and a short tongue is if the tongue is red, it has heat, and if the tongue is pale, it's cold. Swollen veins on the underside of the tongue is a significance of qi and or blood stagnation. Very flat and pale veins on the underside of the tongue is qi deficiency or blood deficiency. When there are cracks on the tongue, the significance of that is a short crack in the center. The area is pale and without coating. There is stomach or spleen qi deficiency. When it's short crack in the center, the area is red and lacks coating. There's stomach yin deficiency. When there is crack in the middle, it's deeper or wider with a sticky yellowish coating. There's stomach fire or phlegm heat in the stomach. Irregular or transverse cracks in the central part of the tongue is an indication of stomach yin deficiency or stomach and kidney yin deficiency. Long crack along the central area with several transverse cracks spreading outwards is stomach and kidney yin deficiency. Cracks all the way down the middle of the tongue and out to the tip is with constitutional weakness with a tendency to heart imbalances. Two diagonal cracks behind the tongue tip is lung yin deficiency, and short transverse cracks on the sides of the tongue is spleen qi and yin deficiency. So let's look at the normal tongue, which is supposed to be soft, supple, extended easily, form, form tapers off toward tip, and no cracks, not too thin or swollen, and no quivers. When the tongue is thin and shrunken red, that's yin deficiency, and shrunken and pale, it's blood deficiency. When the tongue is swollen, if it is the whole tongue, there's spleen and kidney yang deficiency with damp, and spleen and stomach damp heat, and heart and stomach heat when it is red, and alcoholic toxic when it is red, and toxin. Swollen edges is spleen, qi, and yang deficiency. If it's the sides, ascendant liver yang or liver fire. When the tip is swollen, there's heart or heart qi deficiency, depending on the color. With phlegm retention, it's along the central crack. There's heart fire, and the will be red, or heart qi deficiency, and the color will be normal. Half of the tongue is swollen, weakness of the channels. If it's swollen, localized swelling on the sides, deficiency or qi stagnation in the chest. If it's half surface swollen, lung qi deficiency. And if it's hammer shaped, it's stomach, spleen, and kidney deficiency. When the tongue is stiff, there's blazing heart fire. When it is stiff with red or dark red, it's exterior heat invading the pericardium. When it's stiff and red, there's heat injuring body fluids. And if it's stiff but normal color, it's internal wind. For a flaccid tongue, the pale body is flaccid, it's exhausted qi and blood. When it has a red body, it's extreme heat injuring fluids. When it is limp with deep red color, it's kidney deficiency with heat. When the tongue is long, it's blazing heart fire and heart phlegm fire. If it's short with a pale body, it's spleen yang deficiency and internal cold. If it has a red body, heat stirring liver wind. Red body with coat is body fluids insufficiency due to excess heat. Red body with deficient heat, and pale with a slippery coat is spleen yang deficiency with damp and phlegms. When the tongue is cracked, horizontal cracks means yin deficiency. When they're like eyes closed, it's yin deficiency from old age. Irregular cracks is stomach yin deficiency. When transverse cracks on the side is spleen qi and yin deficiency. Vertical and center is spleen qi deficiency as well. If it's cracked long vertical, reaching the tip, it's heart and emotional disorders. Transverse behind tip is prior lung disease and present lung yin deficiency. Deep is central plus small cracks is kidney yin deficiency with heat. When the tongue is loose with red body, it's interior excess heat. Red body, slippery coat is phlegm fire clouding the heart. Pale body, it's heart qi deficiency. And when the tongue is deviated but normal in color, it's exterior wind invading channels. If it's red or normal color, it's interior liver wind, and pale body is heart qi deficiency. When the tongue is numb, and with a pale body, it's heart blood deficiency. Red or normal color is liver wind. Slippery coat is wind phlegm. When the tongue is moving with red body, it's heart fire and internal wind. Red and dry body is spleen heat with body fluid exhaustion. A quivering tongue with pale body is spleen qi deficiency. Red body is extreme heat generating internal wind. If it has a pale body, it's heart and spleen collapse, and pale and thin is yang collapse. A tongue that is rolled on the tip is excess heat when it's rolled over. Tip rolled down is deficiency heat. Tooth-marked tongue is spleen qi deficiency. An ulcerated tongue with red body is heart fire blazing, spleen and kidney heat. If it's red and peeled, it's heart heat from kidney deficiency. If it's sore covered with red body, it's heat toxin in the heart. If it's red and peeled, it's deficiency heat. Thank you so much for your attention.